lot of different data that Select collects. Some is visits a day, some is new patients. I mean, we've got our budget, so we've got a number of patients that we need to see, revenue, that sort of thing, just like any other business. We're checking that weekly, if not daily, just to see where we're at as far as getting our numbers.
You do want to use what is the most beneficial for the patient, and with research and whatnot, you have data that backs up this technique is good for the patient versus this technique can help, but in the long run may not be as beneficial as another technique. We'll do things like journal clubs where someone would talk about an article that they found and kind of talk about how this can apply to our setting.
At the beginning of every shift for the day and night shift staff, I walk around the whole floor and I speak to all of our staff to make sure they're okay, and I find out if we have any challenges that we can improve, take a list down of things that they suggest, and then I bring it back to our leadership team. Everyone's working together to make sure we're all creating processes to make sure we work together and just a great environment.
As a procedure nurse, if we have a procedure coming up, I have to have all the pertinent information that's going to be used for that procedure. I have to know what the labs are, what potential problems we could have. If I don't have the proper information ahead of time, it could have a negative outcome.
I think I do a good job. I try to be there when they need help. I try to be like one step ahead. It makes you feel great. Like they're trying to help. You're making a difference in their life. Might even a few seconds that you are interacting with them, but you're making them feel like they are important. And it doesn't matter how many patients you have. For that moment, that patient is special for me, and that's what I want to make them feel.
To maintain safety throughout your care, you got to think first about everything you do before you do it.